I'll continue with the registration process of the product. The process of product registration is important to ensure that pharmaceutical products are evaluated for its safety, efficacy, and quality. The registration process begins with pre-submission of application. In pre-submission of an application, the manufacturer needs to fulfill some requirement in registering the product. First of all, they need to determine what are the category of the product and understand the method of evaluation of the product. After knowing the type of evaluation, the manufacturer needs to submit all documents listed in the drug registration guidance document under which type of drug it needs to comply. Then the applicant needs to follow the general and specific requirement applied on product registration, such as list of permitted, prohibited, and restricted substance. Then they also need to consider about multiple application, which is normally it is caused by presence of different manufacturer. In this case, separate application is necessary for each product. In terms of variant, tablet does not taken into account since tablet doesn't usually come into many type of fragrance or flavor. Language is the last factor need to be considered, so it is important that all data and information written in Bahasa Malaysia or English. Moving to the next slide, after we finish with the pre-submission process, the submission of application can only be done via online. This has been practiced since 2017 by the NPRA. The process of initial evaluation, or known as screening, will take place, and bear in mind that screening process only starts once all the data or information are complete. Once the application has been approved, payment needs to be done within 30 days and hard copy of the document need to be submitted. Once the payment of the application be made, then further evaluation will be continued. If the application is rejected by the NPRA will notify the applicant via online. Moving to the evaluation process, the application need to queue before being reviewed. There will be separate queue for each different categories. Since our terbinafine tablet is a generic product, it will undergo full evaluation instead of aggregate evaluation. This process will be done according to guideline on facilitated registration pathway, in which specifically for abbreviated and verification view. But in some cases, such as treatment for pandemic situation or product involve change in formulation due to decision or instruction by the DCA, those type of application will be prioritized, and the timeline for review process for generic product is 210 working days. If there is any clarification and further supplementary document needed, correspondence via the system shall be sent to the applicant, and fail to respond to the correspondence will cause rejection of the application. So within 14 days of the approval of the screening process, sample product needs to be submitted to the Center of Compliance and Quality Control for lab tests, or else the application will be rejected. And sample also need to comply with several requirements, or else being rejected by the lab. Okay, in this slide, I've simplified the registration process into a flowchart. The first step is pre-submission of registration application. During that time, GMP inspection will be done by PICS member. Then it will proceed to the submission and screening process. After that, data evaluation process will be done by the CA. Upon approval from the screening process, sample submission need to be done. And finally, the authority of the Director of Pharmaceutical Service will make the decision either the application is approved or rejected. If the application is rejected, we can appeal the application, as it can be done manually by using the template provided in the drug registration guidance document. Send the appeal letter to the NPRA within 14 days from the date of the notification from the authority. This will be followed by the submission of additional document within 60 days from the date of appeal confirmed. The appeal will be evaluated by the authority, and memorandum will be released by the authority and sent to the Minister of Health. If the regulatory outcome is an approval, then the manufacturer may proceed to the post-registration process. Meanwhile, if the application got rejected, the manufacturer may appeal the rejected form again.